Hello everyone, in this video we are going to discuss about hypoglycemia. Hypoglycemia is the conditions when the blood sugar level is less than 60 to 65 milligram per deciliter in adult and less than 45 milligram per deciliter in pediatrics. We call it hypoglycemia. Generally symptoms appear when it is less than 40. The most common cause for hypoglycemia is overdose of insulin and oral hypoglycemic drugs in diabetic patients. Oral hypoglycemic drugs like sulfonylurea, it acts for 24 hours, then there might be cause of hypoglycemia. Other causes includes infections, malaria, sepsis, drugs like quinolones, and adrenal insufficiency, renal failure, liver failure, insulinoma, tumor, and in alcohol, generally there is increase in blood sugar level, but if the patients with alcohol, taking alcohol has liver disease, then there might be development of hypoglycemia. And in withdrawal symptoms, a person taking alcohol has stopped suddenly, then there might be the development of hypoglycemia. The clinical features includes neurogenic and neuroglycopenic. Neurogenic includes tremors, sweating, and palpitation. Neuroglycopenic has mental confusion, disorientation, stupor, seizures, coma, etc. And for investigations, we can go for plasma glucose level, renal function test, serum insulin, C-peptides, and other antibodies. And treatment part, we should maintain the airway breathing circulations. If the patient is conscious, we can go for oral glucose. But if the patient is unconscious, we should give IV dextrose. We should monitor every 4 hourly. First 15 minutes, it should be checked in 15 minutes interval. Then hourly, then 4 hourly. And we should treat the underlying condition as well. Let's suppose if there is a patient with CRBS 60 milligram per deciliter, then we should give 25% dextrose of 100 ml, which contains 25 gram dextrose. Or if it is not available, then we can go for 50% dextrose, 50 ml. Let's see the algorithm. First of all, we should resuscitate and do initial assessment maintaining airway breathing circulations. If the patient is conscious, we can give oral glucose like 25 gram glucose and with 500 ml of water. It should be rechecked in every 15 minutes, and we can discharge if the patient has resolved the symptoms after 24 hours and patient can tolerate overall. But if the patient is unconscious, then we should go for injection 50% dextrose 50 ml IV stat or 25% dextrose 100 ml IV stat. Then we can give 10% dextrose 500 ml over 4 hours till hypoglycemia is corrected. We should measure every 15 minutes. And if the patient hypoglycemia is controlled and the patient is conscious, we can give oral glucose and reassess. If the patient has hypoglycemia is controlled and patient is unconscious, then we should refer after the patient is stable. And if the hypoglycemia is still persists and the patient is unconscious, then we should repeat the dextrose doses 25% or 50%. And we can give injection glucagon 0.5 to 1 mg intramuscularly or subcutaneously, injection hydrocortisone 200 mg IV stat, and we should look for other underlying causes and treat and refer the patients. The dose of glucagons for children is 0.3 mg per kg. If the patient is taking beta blockers, then there might be the maxing of hypoglycemic symptoms. We should be well known about this. And we can give drug named octreotide about 50 to 100 microgram subcutaneously and check the sugar level every 15 minutes. But in case of varicose bleeding, the octreotide has the dose of 25 microgram. And for insulinoma, if we suspect insulinoma, we should check serum insulin level and C-peptide. The both are increased in insulinoma. And we have Hypoglycemia for hypoglycemia. It is low blood glucose level, the symptoms of hypoglycemia, and the symptoms improves after taking the glucose. It is Hypoglycemia. And now let's see one thing. If the person has postprandial hypoglycemia, then there is highest risk of developing diabetic mellitus in future. So we should be conscious about this. Thank you.